Now we'll finish our activity with a few more thoughts and, of course, conclusions. Education, patient education, Carl, we talked about, which is key. That's the first place for anything where we want to have our patients buy into what we think is wrong with them and what we need for them to do. But there's a couple of interesting ways of having patient education. One of them is to have a poster. In fact, I have a poster of shift work disorder right there in one of my exam rooms. That can be pretty effective. Inventories. We did an Epworth sleepiness scale on this patient, which I thought was very helpful. But there's sleep diary. We never really talked about sleep diary. What do you think of that?
And these are 2-week logs or 1-week logs in which the patient can map or can denote what time he or she falls asleep or goes to bed, what time they wake up. Very important in terms of in a semi-objective fashion following sleep-wake rhythms. As you know, if you were to simply ask a person with a sleep disorder to tell you what time they go to bed and what time they get up, they may actually be inaccurate or actually maybe even just point out the worst of those nights over the past 2 weeks. So this is a bit of a semi-objective way of following their sleep-wake rhythms.
You know, Carl, sometimes patients come in and they may have a sleep-wake problem. And they wait until the very end of their visit. And I may not have time to go over that and do a complete sleep history and go on to what's going on. And I may give them a sleep diary to fill out or simply ask them what to do about sleep, have a sleep diary, and then come back at another visit and we can go over what's going on with their sleep-wake situation.
And I think it's very useful because the patient can, during that 2-week period of time, of course, even start utilizing some sleep hygiene measures to improve their sleep.
Okay, and as far as educational handouts, we can certainly give them information on shift work disorder. There are nice little handouts that we can give. There are some websites that you can refer patients to and, in fact, print some information out. And the sleep-wake hygiene measures, I gave one to my patient, so this can all be very, very useful. So, sleep consultation. Carl, you're a sleep physician, you're a sleep specialist, and there are times when we must consult with you. I think one of them is if our clinicians don't really have a level of comfort, don't really feel comfortable treating shift work disorder. They can certainly refer to you, don't you think? I
agree, and of course, as we mentioned before, shift work can very adequately be identified and managed in a primary care setting. But absolutely, when some physicians may not have a comfort level, so referral to sleep specialists may be helpful. In addition, as we mentioned before, some disorders need to be ruled out by polysomnographic or sleep testing measures, certain disorders such as sleep apnea syndrome and narcolepsy. And for those disorders, if those are suspected, certainly referral to a sleep disorders center might be appropriate.
You know, Janet, I asked her specifically about snoring, and she said she doesn't snore. But let's say if a patient came in and they did have snoring, like one of our case studies, there was a snore. So if we suspect somebody that has something else either going on, causing either insomnia or excessive sleepiness, or maybe comorbid with shift work disorder, we have to rule that out. We can have certainly a patient that has shift work disorder and a sleep disorder at the same time, or different with sleep disorder, correct?
Exactly, and some of these comorbid disorders can be highlighted by the patient in whom treatment does not relieve the sleepiness or the insomnia. And in these patients, there may be a comorbid concomitant disorder that may need to be identified in a more specialized setting.
And you know, Carl, some of my colleagues just simply don't have the time to diagnose, manage thoroughly a patient with a sleep-wake disorder like shift work disorder, and that's also an appropriate situation to refer to a sleep center. And finally, if we have patients where we are treating and they're not getting better, they certainly could use your level of expertise.
Exactly.
All right, so let's make some conclusions and some pearls and some very important take-home messages for our audience. First of all, shift work disorder is a consequence of a recurring work schedule that overlaps the usual time for sleep, resulting in a circadian rhythm misalignment. That's the key feature of shift work disorder. Secondly, primary symptoms of shift work disorder include excessive sleepiness and or insomnia. And I think it's important to recognize you can have one or the other or both, right?
Exactly.
Okay. And the consequences, of course, other than the excessive sleepiness and insomnia include mood disturbances, cardiovascular disease, metabolic disorders. So it's not just being sleepy and having trouble sleeping, but also it can affect the entire metabolism and the entire physical well-being. Diagnosis is based on sleep-wake history, and sometimes we can use a log like we've talked about, and management improves alertness, work-related function, sleep, quality of life, among others. Okay, so on behalf of Carl and myself, we would like to thank you for participating in this educational activity, and we hope you found it both informative and enjoyable. Thank you very much.